As of 9:30 a.m. today, 502 new cases of the virus have been identified in Manitoba.
This number of COVID-19 cases is the highest single daily jump since November 23rd, and it has Manitoba's top health officials concerned.
These numbers are alarming.
That's Dr. Jazz Atwell reacting to the latest numbers Friday afternoon. He says case numbers this week are up 25% from last week, and beds in hospitals and ICUs continue to fill up.
Of the 201 patients in hospital right now, 111 are under the age of 70. And of that 201, more than 30% have technically recovered from COVID-19, but they still require significant levels of care.
As the third wave continues to place immense strain on the healthcare system, Chief Nursing Officer Lynette Siragusa announced the province is adding 19 more beds to 4 different hospitals in the next few days to meet the demand of incoming patients, as well as 60 full-time critical care nursing positions at Health Sciences Centre, St. Boniface Hospital, Grace Hospital, and another hospital in Brandon will be added.
So this is a longer-term solution. This isn't going to meet our immediate needs, but it is one that is very important to our overall management of potential future waves, because we think those are still ahead of us.
City News reached out to the Manitoba Nurses Union on the current strain on nurses in the healthcare system and received this reply. The reality is that we do not have enough nurses to fill the current vacancies, not to mention retain the ones we have expressing their desires to exit the profession. We are hearing anecdotally stories of more and more nurses burning out thanks to mandated overtime, nurses whose mental health has been impacted due to the many deaths they witnessed in the second wave, and worse, nurses being shuffled around to accommodate the third wave. Sadly, the Pallister government is the author of their own misfortune.
We really need your help. It's been 14 months, and many of us are tired, but doing everything right. And we need to continue to do our part.
Out of the 201 patients in hospital, 40 of the 201 patients are under the age of 40. This is up from just 1 week ago when there were 149 patients in hospital, with 18 of those patients under the age of 40. Atwell says the situation is drastically changing.
With these even significant restrictions we have in place, we're still generating lots of cases. And there's various different reasons for it. One is there's a lot of transmission out there. There's community transmission out there. Number two is we have restrictions in place. People aren't adhering to the orders, which is contributing substantially to these case numbers as well. So our cases have gone up.
In Winnipeg, Alex Karpa, City News.